in your position there. My question to you is really a two-parter. Do you believe it would be your position that all Americans should have access to affordable health care? And if so, how would you put a little more meat on the bone about how you provide that?
Yeah, Trudy, thank you. Great question. So let's talk about health care. And I think there need to be two steps. The first step, as I mentioned already, is we need to repeal every single word of Obamacare. And the reason for that is we've seen after 6 years of Obamacare, we've seen millions of Americans have lost their jobs, have been forced into part-time work, have lost their health insurance, have lost their doctors, have seen their premiums skyrocket. Here in New Hampshire, y'all have been hammered with skyrocketing health insurance premiums because of Obamacare. And back when it was being proposed, reasonable minds perhaps could have differed on whether it was a good idea. But today, seeing the suffering that Obamacare is causing, I think it is the essence of reasonableness and pragmatism and moderation to say this thing isn't working. Let's repeal it and start over. Now, once it's repealed, everyone agrees we need health care reform. Nobody thinks we're done at that point. So let me describe the principles that health care reform should follow and then some specific applications of those principles. I believe health care reform should expand competition in the marketplace, should empower consumers and patients to make health care decisions in consultation with their doctors, and should disempower government from getting in between us and our doctors. So 3 specific reforms that I think are important. Number 1, allowing people to purchase health insurance across state lines. That's currently illegal. Now what that would do is it would create a true 50-state national marketplace for health insurance, which would drive down the cost and expand the availability of low-cost, catastrophic health insurance. Now, you asked about the availability of affordable health insurance. All of us want to see every American covered. That is an outcome everyone would like to see. If you want to expand access, the biggest barrier is cost. If you ask people who don't have health insurance, why don't you have it? They say, I can't afford it. If you want more access, what do you want? You want more choices and lower costs. What does Obamacare do? Fewer choices and higher costs. So that's step 1, is allow interstate purchases so you have a national marketplace and you drive down the cost. Step 2, expand the availability of health savings accounts so that people can save in a tax-advantaged way for more routine health care costs, for more routine prevention and things short of catastrophic illness or injury. And step number 3 is work to de-link health insurance from employment. You know, most people don't know the history of how it arose that most of us get our insurance from our jobs, which is that arose coming out of World War II, where there were wage and price controls in effect. And employers were not allowed to attract new employees by offering higher wages. You know, we were talking before about paid medical leave. This is actually how health insurance arose. They couldn't offer higher wages, so employers began offering perks like health insurance to attract new employees. And the tax laws incentivized them. Except today, we're not in the 1950s anymore. People don't tend to go work for one company for 40 years, retire, and get a gold watch. We now live in a mobile, transitory society where people move from industry to industry, from company to company, sometimes from city or state to city or state. And if you or I lose our jobs, you don't lose your car insurance. You don't lose your house insurance or your life insurance. There's no reason on earth you should lose your health insurance, and it's the worst one of all because that is what goes to create much of the problem of pre-existing conditions, where people lose their insurance when they lose a job, and then they can't get a new policy because they've gotten sick or gotten injured. So we should reform our health insurance system so that health insurance is personal, it's portable, and it's affordable. And I think that is a much, much more attractive vision of healthcare than is the big government Obamacare top-down system that people are struggling under today.